Hey guys, Dr. Davin Lim, board certified laser dermatologist. Look, I get a question asked every week in regards to, hey, what's the best skincare routine, the skincare cream to use? So we're going to address this. I'm not, as you know, I'm not a product guy. I do a lot of lasers and fillers, but today we're going to talk about skincare products. And we're going to start from the basics, which is basically vitamin A. What are retinoids, retinol, and retinoic acid? And here we go. So, as you can see, there are two different types of, I guess, how I like to put it, two different types of vitamin A creams. Prescription creams and creams which are bought over the counter. Historically, dermatologists are used to using prescription creams because that's what we do, we prescribe. So these creams form the basis of retinoic acid. The first one was called Tretinoin. So this cream basically was discovered in the 1990s, and it is found to actually help with fine lines, wrinkles, brown spots, age spots, liver spots, pigmentation, and can act as an exfoliator. It's, I guess, a jack of all trades, and it's scientifically shown to stimulate collagen as well. So this is the first generation. So that's called Tretinoin, and it's a retinoic acid. The second generation was invented in the late 90s from what I remember. Yeah, I remember doing my residency then. And that was called adapalene. So it's called different. And the third generation, and it's the strongest, is called tazarotene or Tazorac or Zorac in Australia, but Tazorac in the US. So these all form the basis of prescription retinoids. Okay? So what's the difference between that and what you buy over the counter? Like when you go to a beautician or when you go to a cosmeceutical store and buy retinol. Retinol is not an acid, right? It's still considered a retinoid, but what happens with retinol is that retinol comes in different concentrations, but it gets absorbed by the skin. So a tiny portion gets absorbed by the skin, and within the skin, retinol is converted to retinoic acid. So about 5% of it's converted to retinoic acid, and that has its mode of action. So basically this gets converted in your skin to form what's known as the prescription cream that we went through. So how should you initiate, or how should you start on using vitamin A creams? This is how I tell my patients, this is what you do. Try a small amount first. If you get super sensitive skin, use the tiniest amount, something like this, okay? And use a moisturizer. Yes guys, I do have a broken tendon, so it's another 3 more weeks. If you're ever getting surgery by me in the next 3 weeks, give you a hint, delay it. But anyway, so look, let's get back on track. Use a small amount, a pea-sized amount, dilute that with your moisturizer of choice, and it might be half-half. And just mix it in, right? And scatter it on non-sensitive areas. So non-sensitive areas include your cheeks, right? And your forehead. Whatever you do, when you're applying the retinoid for the first time, or if you do get skin sensitivities, avoid the folds over here and avoid the corners of your mouth and avoid the eyes around that area. So it's super important. And the great thing about this is a very common sense cream. Start off with a small amount, increasing it. You might want to start Monday, Wednesday, Friday, increase it from there, add another night, use more of it. If you do get some skin irritation, moisturize more. You can use that with a moisturizer. So remember, when you're buying something like an over-the-counter one, for example, like a Bargi Retinol 1.0, what I would personally do, because they're both the same price, 1.0 and 0.5, I personally would buy the more, I guess, higher concentration one, because they're both the same price, and I would actually use this together with my moisturizer. That way you get a 0.5 if you're diluting it half-half, and then all you do is slowly work up to the 1.0. So don't fall for the marketing out there. Buy the strongest one out there, and then use your moisturizer, dilute it, and then slowly go up from there. When you can actually stand a retinol, certainly you can go to your dermatologist, ask them for a prescription for the retinoic acid, and those are the ones I talked about: the retrieve, the adapalene, and the xarotene. Let's clear up some myths in regards to retinol, retinoic acid. First of all, is it sun sensitive? Yes, it is. That's why you use it at night. The sunlight itself, UV rays, degenerate retinol and retinoic acid, so that's why you use it at night. It can also thin out the upper layer of the skin, it's called collostridium corneum, and that can make you more prone towards sunburn. So if you are using a vitamin A cream, be that extra or sun smart, which is basically the frequent application of sunscreen and hats. Now, does retinol or retinoic acid dry your skin? Yes, it can. In high concentrations, it does, and it does for everyone. Can your skin peel? Yes, it can. So what you've got to do is basically moisturize more. Instead of moisturizing once a day, you might moisturize twice a day. If your skin is super dry, you might put on a moisturizer half an hour before and half an hour later. If your skin is super dry, you might actually decrease the concentration. Can retinol or retinoic acid irritate your skin? Absolutely, because we're using an active ingredient. The higher the concentration, the higher the chances of skin irritation. What do you do then? You can actually do a few things. You can actually dilute the concentration, you can use some moisturizer, you can actually use an anti-inflammatory cream short term by your dermatologist. Now, who can't use retinol or who can't use retinoic acid? Basically, if you're pregnant or if you're lactating, that's a no-no, so you can't do that. And who should be careful? So patients with skin sensitivity, skin allergies, people with eczema, people with sensitive skin such as sebdermatitis, psoriasis, and most importantly, rosacea patients. So if you put a high concentration of retinol onto rosacea prone skin, you will know it. So it'll go really red. It can actually treat rosacea, but you've got to titrate that accordingly and let your dermatologist guide you in regards to that. So hey, those are the most frequently asked questions, and I hope I've debunked a lot of those FAQs. Guys, thanks very much for watching this rather long video on just a simple formula of vitamin A. I guess it's very important to understand the differences between retinol, because that's what you're paying for, and retinoic acid. And look, if you're keen on getting yourself on board in regards to proper skincare, speak to your general dermatologist, because they have a wealth of knowledge, and you can certainly save a lot of money when it comes to buying active ingredients for your skin that actually works. Hey guys, thanks once again for watching. If you like, subscribe. I do one education channel every Saturday. I'm doing more on skincare tips. Yeah, see you next Saturday. Bye.